Hey, today I want to talk about hip dips because you hear so much about that and people want to get those fixed. Now, when I trained, let's say 20 years ago, people called it sort of a violin deformity, right? Like the side of a violin. And then it was called a C-point depression based on discussion of certain anatomical features or landmarks of the buttocks. And then they started to be called hip dips. And really what it is it's really common. It's just an area without as much soft tissue between what in some people can be a pretty significant saddlebag area. And so many people have fullness up here, be it a real, love handle, or in this case, sort of a wider area. Well, what we want is one smooth curve, right? The easiest way, and some people, you can just get that by doing some liposuction in this area. Sometimes there's a lot of fullness here, and liposuction here, and then the saddlebag area will take care of a smooth curve. But in my experience, there's just a lot of patients who it's so thin right here, you're really almost pressing down on, the musculature right there. So what we like to do, if we can, sometimes the best way to fix this, or the only way to fix it, if there's not much fat here, is to take from here and then graft it, kind of like a Brazilian butt lift, right? Sort of the rob from Peter to pay Paul type concept. But we're not really trying to make this area bigger for more, projection backwards. We're just trying to get a smooth contour. And if I have someone on their side and I'm sectioning here, then oftentimes I'll just take that and put it here until when they're laying down from the side, I just see one smooth curve instead of the hip dip. But that's all it is. Anyways, thanks for joining me. See you next week.